We're very pleased to have the potential opportunity to work with the Patient Safety Academy, and I wonder if you could perhaps let us know a little bit about who you are and the work that you do.
I am a human factors specialist. I have trained for a number of years in doing that. So although I'm non-clinical, I have worked in this area for a number of years in applying human factors tools and methods in understanding how we can make our care systems safer and how we can understand how the care system is functioning.
We spend a lot of time investigating poor outcomes, and we try to address human factors in our reports. We spend a lot of time making action plans, but sadly we found that a few months or years go by and we have the same incident occurring again, and it seems that the same root cause analysis shows the same mistakes. And I wondered, what would you bring that would be different?
I think we spend, as you say, an awful lot of time investigating, and it's a massive expensive resource that we're committing to that, and appropriately so. We should be investigating what happens when things go wrong. Perhaps there's the opportunity to change the focus of the investigation. So if we shine our light in our investigation on the individual or the teams that are involved in an incident and neglect to look at perhaps the wider system, then we won't understand in what made sense to them at the time. Why did they do those actions at that time? What the human factors methodologies do is allow us to systematically look at the factors in our organisational systems that predispose us to making that error. So it might be looking at the design of different packaging where two drugs look the same, and that caused someone or made someone more likely to make that error of that medication error. Or it might be that the computer systems were down, so you didn't have the information to make the clinical decision that you would have been able to make if all the information was available to you. The human factors methodologies allow you to systematically work through those, not giving any weight necessarily to any particular area. It allows to look at the human in that context of their work and try and understand and add detail to the complexities of your work. We understand the immense pressure that you're under in the maternity services, and trying to explain those events that led to a poor outcome in a way that then allows us to design our recommendations that will target the wider system. That then adds to the sustainability of the changes that we suggest. So but if you're retraining one individual and that individual then leaves, you've lost the sustainability of the change that you're making. If you can change the layout of your environment, or if you can change the structure of a certain organisation within an area, that's likely to have much greater sustainability and therefore have a better chance of preventing that incident occurring again.
As you know, each birth count recommend that we have an external peer reviewer when we are investigating poor outcomes. Do you think this might help?
So I think this programme of work that we're proposing can completely help and assist with that. So we've currently done a piece of work in the acute trusts in the area looking at how we can support trusts to share the learning from incidents, where we've provided training to those that would like to go and support other trusts in their investigations to ensure that they have the skills and knowledge to properly investigate incidents before they go into those other trusts. And I think you have that opportunity here with your network to offer training in the region in incident investigation, and then that will allow you to then share investigators between the hospital trusts in your region to investigate each other's incidents or assist in the investigations of each other's incidents, which can share the learning from those incidents and also share the good practice that's seen. Because when an incident happens, it's often not that everything was bad. In fact, it's always not that everything was bad. There's always examples of where things went right or where things would have gone right in a different circumstance. And so the sharing of that among the region as well, I think, would be really beneficial to the members of the network.
So what actually are you planning to offer with regards to training in human factors?
So having investigated a number of incidents myself, both locally and in other trusts, and chairing never event investigations over the last 5 or so years, I've learnt the skills and the methods that I think are most useful in applying a human factors framework to investigation. And so together with other members of the Patient Safety Academy, we've developed a curriculum that falls over 2 days where we share the science and the background behind the human factors approach to investigations, which aligns with the HSIB's work in investigation of clinical incidents. And then we talk about how that can apply in the individual trust that you're working in. We talk about the patient's role in the investigation, which I think for maternity is really important. And we do a simulated incident investigation where we give you an incident and then you work as teams using the tools and techniques that you've just learned the day before in investigating that. And then we talk about how to make a recommendation, what type, the different strengths of different interventions and how we can phrase those and how we can target those so that they can have the biggest impact. What we realise is that after 2 days training and chucking you straight back into doing your day job, it's going to be really challenging to apply those lessons. And so what we also offer is a mentoring scheme following on from that, where you can reach out to myself or another member of the team to ask for help if you find something, if you want to use one of the methodologies that you've learned but you're struggling, so that we can provide that support. And then as time goes on, you will have that support yourselves within that network as you all become more skilled and you're using the same language to communicate about the investigations as your peers and your colleagues. And that will then become more self-sustaining.
That's very interesting. Who would you envisage would be coming on this course for training?
So for the investigation course, we've had a whole range of people attend, and where it works absolutely best is if you can have a clinician who's responsible for the investigations within their unit alongside their collaborator within clinical governance, and that's where you get the best outcome because they are out of the workplace having the opportunity to talk about this. They use the time to think about how this applies in their own work situation, and really then you see a much bigger change than if people come in isolation from their different trusts and then go back and try and say, oh, I've learnt this new way of doing something now, but everyone else thinks, well, I only know the old way. So it really works best if you get the team along to learn how to do this.